So the eligibility is based on someone who's been incarcerated within the last 12 months and is a Fort Bend County resident and is willing to participate in the program because it's a voluntary program, it's not mandatory. Our project had to fill gaps in the state strategic behavioral health care plan. The grant also required us to work on a particular intercept in the SAMHSA Gain Center sequential intercept model, and we chose intercept 4, which is re-entry. So re-entry from the jail and then preventing recidivism, preventing them from going back into the jail.
Before this program came into my life, every day was a struggle. I was out there on the streets. I got robbed, I got shot, took all the little money that people would give me to help me. I got jumped on by those that live on the streets, these gang members and so on and so on, that has no respect for themselves as well as anybody else.
Really, I would say that we call it the rapport, but our relationship from the ACT team with the client has been something that has assisted them in change. Meeting clients, and he used terms like, in a sense, feeling hopeless, paranoid, things like that. When we come along, our relationship that we create with the client assists them in overcoming some of those boundaries, reducing some of those symptoms, and then they look forward. In a sense, we act as the assistant motivators for the client.
It's been really uplifting to me. I have a place with a roof over my head. I get food, I get clothing, I get to go to my doctor's appointments, you know what I'm saying, after being cleansed out within from the drugs and poisons of the streets, to where I can really be the individual that I know I was capable of being for once.
My role on the ACT team is a recovery coach and certified peer specialist, and what that means is that I have lived experience and am in recovery from substance abuse and mental health recovery. I was myself homeless. You know, I'd been on drugs for 20 plus years. I was a recovering heroin addict. I'd been diagnosed with major depressive disorder probably when I was 18, but because I was on drugs, I never was able to take care of my mental health. So my sobriety date is July 19th, 2016. I think that when I meet with one of the clients for the first time and I share my lived experience, that it kind of, you know, gives me some kind of credibility with them. And so by letting them know that I've kind of been through some of the same things that they've been through, sometimes it's easier for them to open up and trust, you know, trust me a little bit more.
So I was staying at, well, just various places. I was in a friend's evicted apartment. From there, they got me into a group home and got me out the streets. And they provided me with resources like transportation, so I could go to the intensive outpatient treatment. So I've been clean off drugs, and I'm about to graduate from that.
I was in a place where I knew I couldn't trust people. Like I knew who these people were, and I knew they couldn't be trusted. So just being in a whole different environment, like I said, it just helps me open up. I mean, I could start trusting people. I mean, I could actually, the world isn't just total a mess. You know?
We have served 32 so far. Our target for fiscal year 19 is 50. So we're well on our way to that.